Gray. Now, norovirus cases are rising across the country. In Central Florida, doctors are seeing a surge here as well.
Yeah, I spoke to a local doctor about what you can do right now to keep you and your family from getting sick. The highly contagious norovirus is spreading in the United States and right here in Central Florida.
Generally, norovirus is a sudden onset of vomiting and diarrhea. It is, as I indicated, a miserable infection. When it hits fast.
The most recent numbers from the U.S. Centers for Disease Control and Prevention show there were 91 outbreaks of norovirus reported during the week of December 5th. That's up from 69 outbreaks the last week of November. Numbers from the past few years show a maximum of 65 outbreaks reported during that first week of December. Dr. Timothy Hendricks, the medical director of Advent Health Centricare, says while Centricare doesn't test specifically for the virus, they're treating more patients with these symptoms. The virus most commonly spreads within families, schools, and cruise ships.
Anywhere we see people congregated, we're going to see this spread because this virus can persist on surfaces for days to weeks after being deposited on the surface.
Symptoms typically last for 24 to 48 hours. Dr. Hendricks says if you're sick or want to avoid getting sick, it's back to the basics.
You want to make sure you're washing your hands, not touch a lot of surfaces, not touch your mouth or face, and also stay home if you're sick.
Dr. Hendricks says they're also seeing more cases of flu, which has completely different symptoms than norovirus. If you want to avoid getting sick, he suggests you drink plenty of water and wipe down surfaces that you think may have been infected.
Meantime, the CDC says illnesses on cruise ships have hit a 12-year high. Data shows there were outbreaks on 16 different cruise ships last year, and most of those were norovirus cases. More than 2,000 passengers and crew members got sick.